All right, future nurses, let's jump into female reproductive health.
It can be a tough topic, but so important.
We'll cover a ton today, from basic fertility stuff to serious issues like endometriosis and cancers.
Yeah, really getting you prepped with the need-to-know facts for nursing school.
Exactly. So we're talking infertility, pregnancy loss, those crazy periods.
Oh, and don't forget ectopic pregnancies, infections, menopause, the whole shebang.
Oh, and later we have a special guest, someone with tons of experience, to really break down some of the tougher concepts.
You won't want to miss that.
Okay, let's start with infertility. It can
Got
be
it.
so emotional, right? All those tests and treatments.
Definitely. It's defined as, well, not being able to get pregnant even after a year of trying, without protection.
And it's pretty common, too.
Sadly, yes, it affects a lot of couples. And as nurses, we have to be there for them, explaining things, offering support.
Speaking of sensitive topics, let's talk about early pregnancy loss.
Yeah, another tough one for sure.
We need to understand the different types of abortions. Spontaneous, those that happen naturally, and induced.
Exactly. And providing compassionate care is so important no matter what. Families going through this, they need our support.
Comfort measures, just being there for them, it all makes a difference. Okay, moving on to, well, periods.
The joys of menstruation.
Specifically, PMS and dysmenorrhea, PMS. Those days before your period when you feel totally out of whack.
It's like your hormones are having a party and you weren't invited. Could be those hormone fluctuations or just everyday stress.
And the symptoms.
Oh, the symptoms.
Tender breast, bloating, mood swings, the whole works. Sometimes cravings, too.
So as nurses, we got to help patients manage all that, right?
Absolutely.
Yeah.
Sometimes it's lifestyle stuff, exercise, stress management, sometimes diet tweaks, cutting back on caffeine and alcohol, and sometimes medications might be needed to target specific things.
Okay, and then there's dysmenorrhea when those cramps are just brutal. And there are two types, right? Yeah. Primary dysmenorrhea, that's usually from too much prostaglandin. The stuff that makes your uterus contract. It's like your uterus is overachieving.
And secondary dysmenorrhea.
That's from some underlying condition like endometriosis or fibroids.
So how do we help with the pain?
For the primary kind, sometimes just heat therapy helps, heating pad, hot water bottle.
Yeah, I love those.
Me too. And gentle exercise can help too. But if that's not enough, then we look at over-the-counter pain relief, NSAIDs like ibuprofen or naproxen.
Makes sense.
And sometimes hormonal contraceptives can be helpful too. Birth control pills, they help regulate things and ease the pain. But if it's secondary dysmenorrhea, we got to treat whatever's causing it. That might mean meds or even surgery.
And then there's abnormal uterine bleeding, or AUB, another mystery to solve.
It's basically any bleeding that's, well, abnormal for that woman. Could be super heavy bleeding, spotting between periods, even bleeding after menopause.
Yikes. So many possibilities.
Right. And the causes are all over the map.
Yeah.
Hormonal imbalances, fibroids, polyps. It's a real detective job.
So how do we, as nurses, even start to figure it out?
Well, first, we got to really listen to the patient, get all the details. What's their bleeding like? Any other symptoms? What's their medical history?
Putting all the pieces together.
Exactly. Then, depending on what we find, treatment could be meds or maybe surgery.
Like what kind of meds?
Sometimes hormonal contraceptives do the trick, or maybe progestin therapy. There's also tranexamic acid, which helps with clotting.
Okay, and if it's surgery?
Then it depends on what's causing it, right? If it's fibroids or polyps, they might need to be removed. Or if bleeding's really heavy, there's endometrial ablation. It basically destroys the lining of the uterus.
Wow, that sounds intense.
It can be. And in some cases, they might even need a hysterectomy, which is removal of the uterus.
Okay, let's move on to a more serious topic. Ectopic pregnancy.
Yeah, this is a big one.
It's when the fertilized egg implants outside the uterus, usually in the fallopian tubes.
Right. And it's dangerous. If it ruptures, it can cause internal bleeding.
So we have to catch it early. What signs should we be looking for?
Well, risk factors are important. History of PID, past ectopic pregnancies, using an IUD,
Got it. And symptoms?
abdominal or pelvic pain, a missed period, irregular bleeding. Any of those could be a red flag.
So what do we do if we suspect it?
Get the medical help stat. We're talking stabilizing the patient, checking their vitamins, and working with the doctors to figure out the best treatment.
What could be?
Medication or surgery. Sometimes they use methotrexate, a drug that stops the pregnancy from growing. Or they might do laparoscopic surgery, which is minimally invasive, to remove it and repair any damage.
It's amazing what they can do these days. Okay, let's talk about a normal transition, but one that comes with a lot of changes. Menopause.
Ah, yes. The change.
It's the end of a woman's reproductive years, right?
Exactly. Usually happens around age 52, give or take.
And it's all those hormonal shifts, especially the drop in estrogen, that cause the symptoms.
Yep. And those symptoms can be a doozy. Hot flashes, irregular periods.
Oh, yeah, the hot flash.
Intense heat comes out of nowhere. Some women get mood swings, trouble sleeping, vaginal dryness.
So much to deal with. What can we do to help?
Well, hormone replacement therapy, HRT, can be really effective for those symptoms, but it's not right for everyone.
Right, there are risks.
Exactly. So it's a decision to make with their doctor, weighing the pros and cons. But if HRT isn't an option, there are other things to try. Some antidepressants can actually help with hot flashes.
Really?
Yeah. And gabapentin, it's an anticonvulsant, can help too. And then there's the usual advice. Exercise, healthy diet.
Seems like those are always good recommendations.
Yeah.
Okay, let's move on to infections. Infections of the lower genital tract.
The vagina, cervix, vulva, down there. It happens a lot, and usually it's because something messed with the vagina's natural defenses.
And there are different types.
Oh, yeah. Each with its own fun symptoms, like bacterial vaginosis. That's a bacterial infection. It can cause a fishy smell. Yeah, not pleasant. Then yeast infections, they tend to cause itching and a thick white discharge.
Okay, so what else should we be looking for?
Well, any abnormal discharge, itching, redness, pain when peeing.
So many things to watch out for.
It is, but the good news is they're usually easy to treat.
So antibiotics for bacterial infections, antifungals for yeast infections.
You got it. And of course, we need to teach them how to prevent them. Basic hygiene and no douching. That messes with the vagina's balance.
Gotcha. Now, on to an infection with more serious consequences.
Yeah.
Pelvic inflammatory disease.
PID. That's when the infection spreads upwards from the vagina and cervix to the uterus, fallopian tubes, even the ovaries.
Yikes, that sounds bad.
It can be. Usually it's from STIs like chlamydia or gonorrhea.
But if it's not treated?
Oh, it can cause chronic pelvic pain, ectopic pregnancies, even make them infertile.
That's scary. So we got to catch it early. What are the signs?
Constant lower abdominal pain is a big one. And discharge, fever, chills, maybe irregular periods.
Okay, so if we see those signs, we need to act fast.
Absolutely. Get them on antibiotics right away to prevent those long-term problems.
Oh, on to endometriosis. This one's a pain, literally.
Tell me about it. Endometrial-like tissue growing outside the uterus causing all sorts of problems.
Painful periods, pain during sex, even infertility.
The trifecta. And we don't even know exactly what causes it.
Right. There are theories like maybe menstrual blood flows backwards, carrying those cells to the wrong place.
Yeah, that's one idea, but it's still a mystery.
So how do we even diagnose and treat it?
Well, to diagnose it, they often do laparoscopy. It's a surgery where they can look inside the abdomen and pelvis. As for treatment, it depends how bad the symptoms are and if they want to have kids or not.
So what are the options?
Pain management is key, obviously. NSAIDs, other pain relievers, and sometimes hormonal therapy like birth control pills or GnRH agonists.
GnRH, remind me what those do again.
They basically suppress ovulation and stop the endometrial tissue from growing, which helps with the pain. And sometimes surgery is needed. Laparoscopy can remove those implants and scar tissue. In severe cases, they might consider a hysterectomy, but that's a last resort, especially if they want kids.
Okay, makes sense. Now on to benign tumors. First up, leiomyomas, aka uterine fibroids, non-cancerous growths in the uterus.
Right, and they can be tiny or huge, and they can hang out anywhere in the uterus.
Do they always cause problems?
Nope. Some women don't even know they have them, but others, they get heavy bleeding, pelvic pain, pressure, all sorts of fun things.
So how do we treat them?
Well, if they're not causing symptoms, we might just watch and wait. But if they are, we could try meds first. GnRH agonists can shrink them, but just temporarily. There are also hormonal IUDs or birth control pills. Those can help manage the bleeding.
What if meds don't work?
Then we might consider surgery. One option is a myomectomy. They remove the fibroids, but they leave the uterus intact. Good option for women who want kids.
And if a hysterectomy is needed?
Then, as nurses, we've got a lot to do. Prepping them for surgery, making sure they understand what to expect, taking care of them afterwards, managing their pain, watching for complications.
Right, and helping them emotionally, too, especially if they're going through surgical menopause.
Absolutely. It's a big adjustment.
Yeah.
Okay, on to another common type of benign tumor, ovarian cysts. They're just fluid-filled sacs that grow on the ovaries.
And most of the time, they're harmless, right?
Yep. They often just disappear on their own. But some get big, cause pain, or even rupture. and those need medical attention.
And sometimes surgery, too.
Yeah, if they're big, causing problems, or if we think they might be cancerous, better safe than sorry. Now, one type of cyst is linked to this condition called polycystic ovary syndrome, or PCOS.
Oh, yeah, PCOS. It affects hormones, periods, fertility, even their overall health.
It's a lot to manage, but we can help by addressing the individual symptoms. Often, just losing weight through diet and exercise can make a big difference. Yeah, it can help regulate periods and make insulin work better. And then there are meds, too. Hormonal contraceptives can regulate periods and lower androgen levels, which helps with things like acne and hair growth. And sometimes we use metformin, a drug usually for diabetes. It can help with insulin sensitivity and make ovulation more likely.
Wow, so many tools in the toolbox.
Yeah.
Okay, it's time to tackle a tough topic. Cancers of the female reproductive system.
Yeah, these are the serious ones.
And prevention and early detection are key, right?
Yeah, absolutely. Luckily, we have the HPV vaccine now, which protects against most types of cervical cancer.
That's amazing. What about screening?
Pap tests are crucial. They can catch precancerous changes in the cervix early, and if something's abnormal, we do more tests to see how serious it is and what treatment's needed. Could be anything from just watching it to removing those abnormal cells.
Okay, on to endometrial cancer. We talked about abnormal bleeding, especially after menopause, being a red flag.
Huge red flag. Any postmenopausal bleeding needs to be checked out ASAP.
So how do they treat endometrial cancer?
Usually surgery to remove the uterus, fallopian tubes, and ovaries. Hysterectomy with bilateral salpingo-oophorectomy. That's the fancy term.
That's a mouthful.
It is. And they might need radiation or chemo, too, depending on the stage of the cancer.
Okay, last one. Ovarian cancer. It's called the silent killer, right? Because it's often diagnosed late.
Sadly, yes. The early symptoms can be really vague and easy to ignore.
So we need to know what to look for.
Bloating, pelvic pain, feeling full quickly, peeing a lot. Any of those could be a sign. We need to teach women to listen to their bodies and get anything unusual checked out.
Absolutely. Early detection is so important. So how do they treat ovarian cancer?
It's usually a combination of surgery, chemo, and sometimes radiation. The exact plan depends on the type of cancer, how far it's spread, and the patient's overall health.
This has been so informative. But I know there's even more to learn about these complex conditions. That's why I'm so excited to introduce our expert guest.
Yes, welcome. So glad you could join us.
We're hoping you can shed some light on some of these tougher topics. Let's start with cervical cancer. Can you walk us through the different stages?
Of course. We stage cervical cancer based on the size and spread of the tumor. It goes from stage 0 to stage 3.
And what does each stage mean?
So stage 0, that's the earliest. Abnormal cells are just on the surface of the cervix. Stage 1, the cancer is still small, contained within the cervix.
And as it progresses?
It spreads deeper into the cervix and then maybe to nearby lymph nodes or other organs, stages 2, 3, and 4.
So the higher the stage, the more serious it is.
Exactly. Staging helps us decide on treatment and get an idea of what to expect.
Okay, let's move on to ovarian cysts. Can you break down the different types?
Sure. The most common are functional cysts. They're tied to the menstrual cycle and usually harmless. They just go away on their own. Then there are dermoid cysts. They have weird stuff in them like hair and teeth.
Hair and teeth.
Ew, right? And then there are endometriomas, which are cysts filled with endometrial tissue. Those might need surgery.
Interesting. We've talked about the role of genetics in some of these conditions. Can you elaborate on that?
Genetics are a big part of reproductive health, especially cancer risk, like mutations in the BRCA1 and BRCA2 genes. Those increase the risk of ovarian and breast cancer.
So family history is super important.
Absolutely. We need to know that when we're assessing a woman's risk.
Finally, I'm sure our listeners would love to hear about any new developments in infertility treatments.
Oh, there's always something new. IVF, or in vitro fertilization, has come a long way. We're getting better at stimulating egg production, picking healthy embryos, and making sure they implant successfully. It's a rapidly changing field.
That's amazing. Thank you so much for sharing your expertise with us. It's been incredibly helpful. Now, before we wrap up this first segment, I want to bring it back to the essential role of nurses in all of this.
Yes, nurses are so important in caring for women with reproductive health issues.
Who are often the first point of contact for women seeking care. We have to be ready to provide support and information.
Absolutely. We need to be skilled at assessing their symptoms, educating them, giving meds, and offering emotional support. And we need to advocate for our patients to make sure they're getting the best care possible.
Speaking of care, let's talk about nursing care for women who are having gynecological surgery.
Yeah, these are major procedures. Patients need special care before, during, and after.
What are some key things nurses do post-op?
Lots of things. We watch for bleeding and signs of infection, manage their pain, help them get moving, and prevent complications like blood clots. We also help them with any emotional issues and make sure they understand what to do when they go home.
And some surgeries have long-term effects, right? Like a hysterectomy.
Exactly. Removing the uterus can have both physical and emotional consequences. We need to help women deal with surgical menopause if their ovaries are also removed.
And what about oophorectomy, where they remove the ovaries?
That causes immediate surgical menopause, which can be really tough. We need to talk about hormone therapy options and help them manage the symptoms.
And then there are surgeries like vulvectomy and pelvic exoneration. Those must be incredibly difficult.
They are. They involve removing the vulva or even the entire pelvic floor. It has a huge physical and emotional impact. Nurses help these patients heal and adjust to the changes in their bodies.
It's clear that nursing care in this area requires a deep understanding of both the medical and emotional aspects of these conditions. And with that, we'll wrap up part 1 of our deep dive into female reproductive and genital health.
Back again for more on female reproductive and genital health.
Ready to keep learning?
Perfect. This time we're focusing on the nitty-gritty of nursing care.
Sounds good. So how do we actually manage these conditions? What can nurses do?
We'll talk about specific interventions, treatments, and of course, patient education.
Gotta empower those patients. Okay, let's start with PMS and dysmenorrhea.
Ah, yes, the monthly struggles.
How can we, as nurses, help women deal with these?
Well, with PMS, it's all about managing those symptoms, right? We think it's a mix of hormones and stress, so lifestyle changes can help.
Like what? Give us some examples.
Encourage them to exercise regularly, find healthy ways to cope with stress. Even simple things like cutting back on caffeine and alcohol can make a difference for some women.
Okay, those are good tips. Now, what about dysmenorrhea? Those super painful periods.
We got to figure out if it's primary or secondary dysmenorrhea first. Different causes, different approaches.
Right. Primary is usually from those prostaglandins.
Yep. For that, non-pharmacological stuff can be really effective, like heat therapy.
Oh, yeah. Heating pads are lifesavers.
Seriously. Gentle exercise can help too.
Makes sense. But what if that's not enough?
Then we look at medications. Over-the-counter pain relievers. NSAIDs like ibuprofen or naproxen.
Those are usually go-tos, right?
They are. And sometimes hormonal contraceptives can help too. Birth control pills can regulate things and reduce the pain.
Okay, that makes sense for primary. What about secondary dysmenorrhea?
Then it's about treating the underlying cause, right? If it's endometriosis, for example, we might need to think about hormone therapy or even surgery.
So it really depends on the individual patient.
100%. Okay, moving on to abnormal uterine bleeding, or AUB.
This one can be tricky, right? So many possible causes.
Totally. Could be hormones, could be fibroids, polyps. We got to do some detective work. The first step is a thorough assessment. Really listen to the patient, get all the details about their bleeding, other symptoms, their medical history.
That's a puzzle, figuring out what's going on.
Exactly. Once we have a clearer picture, we can work with the healthcare team to decide on the best tests and treatments.
And those treatments could be medication or surgery, depending on what's causing the AUB.
Right. Let's talk meds first. Hormonal contraceptives, like the pill or hormonal IUDs, those can often regulate periods and reduce bleeding. Or maybe progestin therapy. Sometimes we use tranexamic acid. It helps with clotting.
Okay, interesting. Now, what about surgical options?
If we find fibroids or polyps are the culprits, surgery might be the way to go. They could do an endometrial ablation. That's a procedure to destroy the lining of the uterus. And sometimes a hysterectomy is necessary, but that's usually a last resort.
Makes sense. Okay, let's switch gears to ectopic pregnancy. We know this is a serious situation.
Very serious. Early detection is key.
So, what are the warning signs we need to look out for?
We're talking about risk factors like history of PAD, previous ectopic pregnancies, or using an IUD, and symptoms like abdominal or pelvic pain, a missed period, abnormal bleeding. If we see those, it's time to act fast.
What should we do?
Get them immediate medical attention, stabilize the patient, monitor their vitals, and work with the doctors to come up with a treatment plan.
Which could be?
Medication or surgery. Methotrexate is a medication that can stop the pregnancy from growing. Or they might do laparoscopic surgery, which is minimally invasive, to remove the ectopic pregnancy and repair any damage.
All right, let's talk about menopause. It's a natural transition, but it can bring some big changes.
Big time. And nurses play a key role in educating women about it. There are a lot of myths out there.
What kind of myths?
Like, some people think menopause means the end of a woman's sexuality or her enjoyment of life. Not true at all.
It's just a new chapter.
Exactly.
Good.
And with the right support and information, women can handle this transition with confidence.
Okay, but let's be real, those symptoms can be tough. Hot flashes, for example.
Oh, the dreaded hot flashes.
Yeah.
Intense heat out of nowhere. It can be really disruptive. But there are things that can help.
Like what?
Simple things like dressing in layers, avoiding triggers like caffeine and alcohol. Relaxation techniques can also be helpful.
What about hormone replacement therapy? Or HRT? Is that an option for everyone?
HRT can be really effective, but it's not right for all women. There are risks to consider, so it's important for the patient to talk to their doctor and make an informed decision.
What about women who can't take HRT or prefer not to? What are their options?
There are some non-hormonal options that can help. Some antidepressants can actually reduce hot flashes, and gabapentin, which is an anticonvulsant, can be helpful too. And of course, there's the good old advice: exercise and a healthy diet.
Those always seem to be good for everything.
Pretty much. Okay, let's talk about infections of the lower genital tract.
Super common, right?
Bacteria, yeast, viruses, all sorts of things can cause them.
So what's important for nurses to remember when caring for women with these infections?
We need to be able to identify the specific type of infection because each one presents a little differently.
Could you give us an example?
Sure. Bacterial vaginosis often causes a fishy-smelling discharge. Yeast infections, on the other hand, usually cause itching and a thick white discharge.
Okay, makes sense. So once we know what we're dealing with, we can give the right treatment.
Exactly. Antibiotics for bacterial infections, antifungals for yeast infections, and of course, patient education is key. Good hygiene, avoiding douching. These can help prevent those infections in the first place.
Now let's talk about a more serious infection. Pelvic inflammatory disease, or PID.
This one can have some serious consequences if it's not treated quickly.
Like what?
It can lead to chronic pelvic pain, ectopic pregnancies, and even infertility.
Yikes. So we've got to be on the lookout for it.
Absolutely. Nurses need to be aware of the risk factors like having multiple sexual partners or a history of STIs. And we need to know the symptoms: lower abdominal pain, fever, abnormal discharge, pain during intercourse. If we see those red flags, we need to act fast.
Get them on antibiotics right away.
Yeah.
Okay, back to endometriosis. It's a tough one to diagnose and manage.
It really is, and it can cause so much pain.
Painful periods, pain during sex, infertility. How can we help these women?
Pain management is a top priority. We have a few tools we can use, like NSAIDs and other pain relievers. Hormonal therapy can also be effective, things like birth control pills or GnRH agonists.
Remind me again how GnRH agonists work.
They basically shut down ovulation and stop the endometrial tissue from growing, which helps reduce the pain. And in some cases, we might need to consider surgery.
What kind of surgery?
Laparoscopic surgery can remove endometrial implants and scar tissue. In severe cases, a hysterectomy might be an option, but we try to avoid that, especially if the woman wants to have children.
Okay, let's move on to the 9 tumors, starting with leiomyomas, those uterine fibroids.
These can be tricky because some women have no symptoms at all, while others have really bothersome ones.
Right, heavy bleeding, pain, pressure.
Exactly. If they're causing problems, we can try medications first. GnRH agonists can shrink them, but only temporarily. There are also hormonal IUDs and birth control pills that can help manage the bleeding.
And if those don't work?
Then we might have to consider surgery. A myomectomy removes the fibroids but leaves the uterus intact, which is good for women who want to have kids.
What about when a hysterectomy is necessary? What are the key things for nurses to remember in those situations?
It's all about providing excellent care before and after surgery, making sure the patient understands what to expect, managing their pain, watching for complications, and providing emotional support too, especially since they might be dealing with surgical menopause.
It's a lot to handle. Okay, now on to ovarian cysts. Those fluid-filled sacs that grow on the ovaries.
They're really common, and most of the time they just go away on their own.
But some do require treatment, right?
Yes. If they're large, causing symptoms, or we suspect they might be cancerous, then surgery might be necessary. We always err on the side of caution with ovarian cysts.
Okay, we can't talk about ovarian cysts without mentioning PCOS.
PCOS is a tough one, but there are definitely ways to manage those symptoms. Lifestyle modifications are key.
Like what?
Losing weight through diet and exercise can make a huge difference. It helps regulate periods and improve insulin sensitivity.
Makes sense. Are there medications that can help with PCOS?
Yes. Hormonal contraceptives can help regulate periods and reduce those androgen levels, which can help with things like acne and excess hair growth. Metformin, which is usually used for diabetes, can also be helpful. It improves insulin sensitivity and can help with ovulation.
Wow, we've covered so much ground. From managing painful periods to talking about ovarian cysts and PCOS, it's clear that nurses play a vital role in women's health.
We absolutely do. And it's not just about the physical aspects. It's about providing emotional support and empowering women to take control of their health.
Absolutely. Stay tuned for the final part of our deep dive where we'll wrap up our discussion and leave you with some food for thought. We're back for the final part of our deep dive into female reproductive and genital health.
We've covered so much ground, from common menstrual issues to the more serious stuff like cancer.
And through it all, we've emphasized that holistic care is crucial. We can't just focus on the physical. We have to address the emotional and social impact too.
Exactly. It's all interconnected, isn't it?
Absolutely. And as nurses, we have to be sensitive to each patient's unique needs and experiences. Okay, before we wrap things up, I want to pose some questions to our listeners.
Love it. Get those brains working.
So first, how can nurses ensure that we're providing culturally sensitive and inclusive care to all women?
That's such an important question. We have to remember that cultural beliefs and values play a huge role in a woman's healthcare decisions.
It's about meeting them where they are, respecting their beliefs and preferences.
Right. We need to be aware of our own biases and make sure we're creating a safe space for women to talk about sensitive topics without judgment.
Absolutely. Now, another important question. How can nurses advocate for better access to reproductive health care, especially for underserved communities?
Access to quality care is a basic right, but so many women face barriers, whether it's financial, geographical, or systemic.
It's a huge problem, and as nurses, we have a responsibility to speak up and advocate for change.
We do. We can support policies that promote equitable access to care for all women.
And we can work within our communities to raise awareness and connect women with the resources they need.
Exactly. There are amazing organizations doing incredible work, and we can help bridge that gap.
Okay, one last question to really make our listeners think. How can we, as future nurses, contribute to research and innovation in women's health?
I love that. Nurses are right there on the front lines, seeing firsthand what the challenges are.
We have a unique perspective
Yeah.
and can offer valuable insights to improve care.
For sure. By participating in research, we can help develop new treatments and preventive strategies that will benefit women for generations to come.
It's about pushing the boundaries and constantly looking for new and better ways to care for our patients.
Absolutely. And that means staying up to date on the latest research, attending conferences, and never stopping learning.
It's a dynamic and exciting field to be a part of. So, to all our future nurses out there, embrace your passion for women's health, stay curious, and always be an advocate for your patients.
You have the power to make a real difference in women's lives.
This deep dive has been a journey, but remember, this is just the beginning of your learning. Keep exploring, keep asking questions, and keep diving deep into the world of women's health. We'll see you next time on The Deep Dive.